I'm Chris Reed outside St. George Regional Hospital. We're hearing from a lot of viewers who are telling us that it's more difficult to get the COVID vaccine this year. But is it really that different from last year?
There is a difference. It was much easier a year ago to get the COVID vaccine than it is now, today.
Caitlin Jasonbach manages immunization for the group that represents public health professionals in Utah. According to the Associated Press, the FDA approved this fall's COVID vaccines for seniors, but people under 65 would only be able to get it if they had a high-risk condition.
It has to be a qualifying health condition. A lot of times it's actually a lot of conditions that most Americans, a lot of Utahns have, things like asthma. It can even include being overweight or obese.
And even then, Salt Lake County Health Director Dorothy Adams told the county's health board Thursday morning that the era of the free COVID vaccine may be over, as the government is no longer footing the cost and neither are many health insurance providers.
Respiratory illness is real, right? Whether it be called COVID, it's just interesting that they're covering flu, but they're not covering COVID.
It also might just come down to who your pharmacist is.
CVS and I think Walgreens is potentially also included in that list of pharmacies that are either not providing it or it's a little bit harder to access than maybe at another pharmacy.
According to the Salt Lake Tribune, CVS says it's not offering the COVID vaccine in Utah, citing state regulations. Jason Beck says that could be an issue for those whose insurance will only cover a certain pharmacy. Bottom line, Adams and Jason Beck say, is if you're over 65 in Utah, you still have access to the vaccine, but may have to pay for it. If under 65, you may need a prescription. Jason Beck said ultimately the best person to get help from may be your doctor. From St. George, Chris Reed, Fox 13 News, Utah.